Hi, my name is Dr. Harish Puranik. I am a consultant orthopedic surgeon at Fortis Nagarbhavi. I work with special interest in arthroscopy and joint replacements. But I am very happy to be here today along with this wonderful team of doctors and clinical and non-clinical staff at Nagarbhavi Fortis, where we are at the cusp of becoming a truly super specialty hospital and at the forefront of providing the best of best facilities for people in and around this area. I would like to talk about orthopedic practice in this setup. And over a period of several years, we have now seen that orthopedic practice has bubbled into specialty services. We have different specialty services today pertaining to joint replacements, arthroscopy and sports injuries, pediatric orthopedics, orthopedics which deals only with tumors or which deals with hand microvascular surgeries and brachial plexus and things like that. A couple of them which are extremely difficult to manage and extremely super specialized are onco-ortho, which basically deals with tumors around bones, and pediatric orthopedics, which is orthopedics pertaining to children. Now, if we look at orthopedic oncology, which basically deals with tumors in the bone, there are a few peculiarities of this particular branch. Most important of them being the fact that orthopedic tumors are found across a varying age group, from children as small as 6 years to elderly of 80 and 90 years. You find different kinds of tumors affecting different age groups. And this is a peculiar problem because the treatment for each of these age groups become completely different. So every time we encounter a patient with a bone tumor, the management has to be specifically tailored to that particular individual. Therefore, it's highly essential that a team works on each one of these patients individually. A team that comprises of an oncologist, of an oncosurgeon, of an orthopedic oncologist, along with general physicians as well as a plastic surgeon, is essential to ensure that each one of these patients get the best of the treatment. So our ability to form a team and provide the best of these services so that every patient who is suffering from an orthopedic tumor can come out of it is what is there at present with us. And this is what makes us extremely special. Apart from this, the fact that this particular branch of orthopedics is growing rapidly, especially with the modern technology that we have, with our ability to plan surgeries and with our ability to excise these tumors in complete and replacing these tumored bones with new and modern implants. These implants are not only spanning across joints and bones, but the fact that these implants can survive for more than 20-25 years. Now, we have the ability to use these implants across any of our patients, and therefore we believe that we are at the forefront of providing such tertiary care to people who are needy. Apart from orthopedic oncology, we also have specialized in pediatric deformities and pediatric orthopedics. Now, this is another branch that is highly specialized, and there are very few centers which can cater to this kind of specialized work. The fact that we understand that children are not mini adults. Children have their own specific problems. So any injury to children or any fracture of bones in children are dealt with completely differently. They are not dealt as mini adults. And the way their bone behaves, the way their bone acts when they are put in a plaster, along with the fact that children have their own issues, anxiety among parents, the fact that the children may have deformity at a later date, all these combined and put together creates a different set of problems. And we are here as a team to sort out these problems and give the best of care. So we are at the forefront of providing best of the treatments for any of the pediatric orthopedic problems. We also understand that these orthopedic pediatric patients behave very differently, and the amount of deformities that they come through, most of them are treatable if we have a sound understanding of not only when to operate, but how to operate. Then that gives a great amount of confidence to our patients, because not all these patients require surgery. So it is very important for us to understand that some of these deformities over a long period of time gradually get corrected. while some of these deformities get worse over a period of time. So to understand not only that when the surgery is done, the surgery has to be done well, but also the fact to understand whether a surgery is required or not, and to not operate on these patients and give confidence to the patient's attenders that these problems will get better over a period of time is a very, very important aspect of pediatric orthopedics. As a team, we are able to provide every single subspecialty of orthopedics, whether it is pediatric or whether it is pediatric deformities or orthopedic oncosurgery or any of these. We are happy to provide specialized tailor-made services to any of the patients at Fortis Nagarbhavi. So we wish to bring this technology and this team to every individual so that they can take this up and use this for their benefits. Thank you.